Hi, everybody. Thank you so much for joining. I am super excited to be here with Dr. Stephen Goudy. We're going to be talking about all things babies and RSV and preparing for the winter and fall winter season. If you don't mind, before we get started, there should be a little poll that came up on your screen, whether you're on your computer or on your phone. It's nice to be able to just get a sense for us to know who's here. So tell us, are you expecting your first baby? Are you pregnant? Are you expecting a second or third baby? Are you a new parent, maybe a grandparent or a caregiver, or anything else? So it'll be helpful for us to just get a sense to tailor this conversation to those who are on the call. We'll get started in just a moment or so. The other housekeeping piece of information, which I'll share more as we go, is that there's a chat bubble or box on your screen in your window where you can ask any question at any time. So feel free, please type in questions, type in many questions, as much as you want to know, and we'll be able to ask questions throughout from you, the audience, and then we'll save time at the end specifically for questions. But feel free to take this moment just to locate where that is. And we'll get started in just a second. And Dr. Goudy, just so you know, right now, most parents here are new parents, so they've recently had a baby. You're welcome to tell us when, if you'd like, in the chat. And then some are expecting their first. So we have some pregnant parents or expecting parents as well. And then some others, so maybe they have young children at home or something else. I'm going to close this poll in just a moment. I'm just going to give the last couple people a chance to fill it out, and we'll get started.
It's exciting having first baby.
I know. I'll share a moment. We have a 4.5 and a 2.5-year-old, so we're like,
wow.
The third is like distant in the back of the mind, but not completely gone yet from the planning stages. So we'll see.
Yeah.
Okay, so I'm going to close this poll, and thank you. So it's similar to what the results were before. Most folks here are new parents, and some are also expecting. So thank you, everybody, for coming. I know most of you who have been on these calls before expect to see Sarah, who's the founder and CEO of Populist. She is away with her family this week, so I'm very excited to be here. My name is Emily. I'm the head of content at Populist. I'm a mom of two, and as I said, an almost 5-year-old and a 2.5-year-old. So this is super exciting for me to speak with you, Dr. Goudy, and just get to know you and all of the fabulous advice and recommendations you have for families. So quickly, just one more thing before we hear from you. It's exciting to hear where everybody is calling from or listening from. So if you don't mind just letting us know in the chat where you're from, what state, where you live, we can just get a sense of where everyone is. I'm in New Jersey, where it is raining. And Dr. Goudy, you're from Atlanta, is that right?
That is correct.
Amazing. Okay, cool. So we have some folks here from the West Coast, from California. Welcome. I hope it's sunnier where you are. Some folks up from North Carolina. Great. New York. Cool. Chicago. We'll be in Chicago in a couple of weeks. We are coming to the Prego Expo. That's coming there soon. Okay, fabulous. Feel free to continue to add that into the chat, ask any questions as we go. But to get us started, Dr. Goudy, welcome. And why don't we just start off with a quick intro? Tell us who you are, what you do, and then we can hop into some questions for you.
Yeah, great. Thank you very much. It's great to be here. I'm super excited to be talking to you, as well as all of these either first-time parents or soon-to-be first-time parents. I think that is a daunting place to be, but hopefully we'll help educate and demystify some of the questions you may have. I'm a pediatric otolaryngologist. That means an ear, nose, and throat doctor. So boogers, earwax, breathing, swallowing, hearing, all those kinds of things. I practice in an academic, tertiary, or kind of complex children's hospital. I'm also the chief medical officer and founder of Dr. Knows Best, which is a brand focused on baby health and wellness in the upper respiratory space. And I have 3 kids, 21, 19, and 14. So I've been there, I've done that, so I can at least tell you what not to do.
Oh yeah, and as I've heard from many friends, the challenges change, but it doesn't get easier. It just gets maybe more complicated and different as kids get older. So I will
Right.
be asking you for advice. Okay, fabulous. So let's jump into the topic, which is preparing for the RSV season and sort of understanding how parents can, know what might come their way or how to prevent it. So, because we have so many new parents on the line, maybe just give us an overview of what the first year looks like for babies in their breathing, and maybe set the stage there. What does the first year look like? Do babies come out fully developed? How does that look?
Right. So I think obviously breathing is something we all do and take for granted. As you're having your first baby, there's not a handbook. You go in, you deliver your baby. They may allow you to go home within 24 hours with a brand new, very complicated toy that has no manual. And so thinking through kind of the important things as a parent and as a healthcare provider, breathing, eating, sleeping, pooping. Those are kind of really the first year. That's like the totality of the first year of being a parent. And so a lot of people don't understand or recognize that babies really breathe primarily through their nose for the first year of life. They don't breathe much out of their mouth. And so when they get a bad cold, they get congested, they can't breathe, they can't eat, they can't sleep, and then you don't sleep. And so really, that nasal hygiene is what we call it. So cleaning out the nose, making sure that they can breathe well, and then they can eat well, and then they can sleep well. So babies get sick quite a bit, and that's them building up their immune system. So, I don't recommend going out and letting your kid get sick, but if your child is in daycare, they're going to get sick 6 to 10 times a year or maybe more. And so those of us that have done the daycare shuffle know that babies get a lot of congestion in their nose, then they can't breathe, eat, and sleep. So I'll stop there, but I can go on. I love talking about it for a very long time.
No, this is great. And of course, as you're speaking, I swallowed water down the wrong pipe. So excuse me for my
Yeah, but
cough.
that's a great demonstration of breathing and eating. Like babies, and actually that's great because babies really primarily breathe out of their nose because their voice box is a little higher, and that allows them to breathe and eat simultaneously. And so you can kind of hear them rhythmically sucking and breathing simultaneously. So, but as an adult, you just found out you can't do both.
I was like, I should probably mute myself so I can cough and not disturb you. So thank you.
Yeah.
Okay, so that's super interesting. I didn't know that about the nasal breathing. That is a super interesting thing. And I guess parents wouldn't know that either. Like, you think they cry and it comes out of their mouth, they probably breathe and it comes out of their mouth, but
Right.
most of it isn't. So interesting. And so when a baby gets sick in the first year, what do you normally see? Are they viral infections, bacterial infections? What is the difference between those two? I know we hear the word infection and we might think antibiotics, but what does that really mean usually for babies?
Right. I mean, and I think having a very good relationship with your pediatric healthcare provider, your pediatrician, nurse practitioner, physician assistant, whoever that person is important because they will give you guidelines about how to think about things, right? Obviously, if your baby looks or is acting really sick, then that's a medical emergency. And a fever in the first 2 weeks of life is different than a fever in the first 2 months versus the first 2 years. So I'm not going to go through every part of that. I would say that assuming you've had a good relationship and kind of a debrief with your pediatrician, if your child is 6 months old and has been in childcare, daycare, and she or he comes home and has kind of clear nasal drainage, in general, that's a viral infection. Viral infections are incredibly common, and just because kids in daycare are close to each other, they're touching the same toys, sneezing, coughing, whatever. I mean, here in this kind of post-pandemic or this endemic nature, we're very familiar with viral transmission. And that's 99% of what you're going to see in general, particularly as a clear runny nose,
Yeah.
and then, to some degree, they will develop a bacterial infection for those about 10% or less. And we can kind of go into the signs and symptoms of that. And then, maybe we can also talk about allergies, because a lot of folks are convinced that their young child has allergies when it really ends up being a virus.
That's interesting. Okay. Yeah, I think I've thought all of those things. I didn't know, they come home from daycare, they're just sort of chronically mucusy is what it just sort of never goes away, or maybe one leads into the next and they're just sort of congested for many months at a time. Typically, in the first year or so of a baby's life, if they do get a viral infection, how long does that typically last? Is it like a couple of days? What's the just average length, just so parents have an understanding of that?
Yeah, I would say that the average virus is a 7 to 10 day illness. And so, you know, again, there's different kind of phases
Okay,
to it. It
yeah.
may start off with a fever. They may be having some congestion, then it begins a cough. And, for whatever reason, as a parent, it all seems to get worse at night, right? For whatever reason, and certainly the nasal hygiene is important, humidification is important, eating, all those kinds of things. But there is a cycle of things, and in general, a virus will get worsening symptoms. It'll kind of plateau, and then should get better. The runny nose part you can manage. The cough part, there's not a whole lot to do about that, which is frustrating. The humidification, you can control that, and just looking for signs and symptoms of dehydration and respiratory distress are some of the important things.
Okay, that's really helpful. Yeah, we are very familiar with like the steamy shower or the bathroom where it gets all fogged up and it helps. So let's get into sort of talking about RSV. Maybe just start with what it is. Like, what is RSV? We hear the acronym, but maybe parents don't really know what it even means.
Right. So there's tons of different viruses. So when your child has a virus, it could be many. And RSV is called respiratory syncytial virus. So it is a virus that comes in kind of peaks throughout the winter time. So starting as soon as October, and sometimes a little bit earlier, and then kind of tapers off in March or April. So, when your child comes home from daycare and has a runny nose, it's not necessarily going to be RSV. It might be rhinovirus, enterovirus. There's a lot of different names. However, the reason why people know RSV is because it causes significant upper, meaning nose, and lower, meaning lungs, kind of mucus and symptoms and so on, and can lead to significant hospitalization and other things. And so it is a virus. There's not a medicine to treat it. When you get a virus, you just have to wait and your body will take care of it. The issue being is that children during particularly the first 6-9 months of their life, don't really have a strong immune system, meaning that they're living off the antibodies of their mom. And then over that period of time, they're kind of like trying to figure out how to respond to these things that are coming at them. So, children who have prematurity, immune differences, heart differences are really not susceptible, but at risk when they get these infections.
Yeah, of course, and that's something new parents are certainly at this time of year are looking out for. And in those younger infants, or even just in babies in general, what are the signs a parent should be looking out for? I know the clear runny nose was something that might not indicate RSV, but like, what are some things that are sort of red flags or warning signs?
Yeah, and again, this gets back to developing a close relationship with your pediatric care provider, just because they should provide to you, or you should ask them, in one of the initial well visits, like, what are the guidelines when, I would assume most of the providers are going to give you kind of like, here's what to expect, here's when we want you to call. Because as we discussed earlier, if your 2-week-old has a fever, is very different than your 6-month-old. And if you're looking as a parent, the American Academy of Pediatrics has a lot of information on their website, American Academy of Family Practice, and so on. So the information's out there, you can get it. You need to work within those guidelines. What I tell families is, is your child, eating, drinking, breathing. Those are again, we talked about and pooping. Those are the 4 things that kids do, right? And if they're not eating well, do you have concerns about dehydration? And why are they not eating well? Because they not breathe through their nose, or they're breathing too fast, and they have their lungs are kind of working really hard. Those are kind of some of the early signs. Obviously, high fevers, they're not responsive. Those can be very concerning. And then looking at their work of breathing, or just their respirations, right? You and I sitting here breathing normally, we don't look like we're labored, but if you ask me to sprint around the block, then I might come back and go, panting or retracting, which is where the skin over your neck is pulling in, or the skin under the ribs is pulling in. Those are signs of significant respiratory distress, potentially, and that would be more concerning.
Okay, so that's really interesting. So on a baby, that's sort of where you're looking at the base of the neck or throat, and then under the ribs. Correct. And seeing those retractions. Yep. And it looks like they're significantly having trouble breathing. Okay, that's really helpful. And that's the case, I assume, for RSV or any sort of significant viral or bacterial infection, congestion, stuff like that. Okay.
Correct.
Do you see a lot of coughing in RSV? I assume so, right? That's one of the main symptoms. Yeah. Is it like that wet cough, or is it like more of the like barky seal cough?
So the barky seal, the answer is that yes, it could be any, but the barky, or seal-like cough is more seen with croup, which is a different virus. It's the paramyxovirus. For whatever reason, it likes to cause inflammation right at or below the vocal cords. Whereas RSV causes a ton of, not to be gross, but it's just a lot of boogers, right? And so the kids get stopped up, and then the same amount of boogers that are trapped in their nose are also down in their lungs. And so the RSV just makes a ton of boogers in the upper and lower airway, and they just can't handle it, and then they, as you just demonstrated for everybody live, is that, if you have to choose between breathing or drinking, breathing comes first. And so they won't drink. Their respiratory rate, their breathing, as you breathe in, one of the purposes of the upper airway is to filter out what you breathe, right? That's why you want to breathe through your nose, so you're not inhaling, dust, particles, allergens. But not only does it filter it, but it warms the air, right? But if you're breathing and panting, you're expiring a lot of that warmed air that's humidified, and so you're losing. Not only are you not taking in enough liquid, you're breathing out a lot of liquid too, and you get dehydrated very quickly. And so that's another thing these get in trouble with, and they have to be admitted to the hospital to really suction out their nose and to give them fluids. And that's one of the reasons we actually invented our nasal suction device, because a family member told me once, like, look, dude, I don't need you. I just need better suction at home.
Okay. Well, so we're going to get into that, because we have a lot of questions on sort of like how you can care for this at home. And this is really important. I didn't realize that the breathing can actually contribute more to dehydration, because you're sort of expelling more fluid working on the breathing. I'm describing it in this?
Yeah, right. Because as you breathe in, your body is adding humidity to the air, so that it's not like dry, like if you've ever walked outside and you breathe in the air and your lungs start to get tight and crackly, because it's really dry air. So your upper respiratory tract humidifies the air that you're breathing in. And that's why humidity is important to your lungs functioning, to not coughing, to not being, irritable in your airway.
So do you recommend, increasing liquids or fluids for children during a viral infection, just to sort of counteract that?
Yeah, I think certainly, a lot, again, the daycare shuffle, they may have diarrhea, they may have all this other stuff. So it can be, fluid management is a very critical thing. So one of the easiest ways to know how your child's fluid status is, are they having wet diapers, right? Like if they're not peeing, that means that they're really getting dehydrated. Obviously, if they're crying and they don't have tears, or if their skin is like, you can pull it up and it doesn't snap back. I'm not suggesting people pinch their children, but those are all the things we look at
Yeah,
as medical providers,
sure.
but really just monitoring their intake, right? Like if you're I mean, obviously, if they're breastfeeding, you can't necessarily quantitate it, but if you know how long they feed, or they're taking a bottle and you can quantify how much they're taking in, compared to what it was before. If they're not taking anything in, they're going to get dehydrated.
Yeah, that's super helpful and super important. So we're going to talk in a moment about sort of the home remedies, but just to sort of close this signs of infection moment, and obviously, when in doubt, seek medical advice or attention. But the sort of like key signs, I should actually just go to the hospital. Do you want to just give maybe a summary of those? And obviously, with the caveat that err on the side of caution, talk to your doctor, as you've mentioned. But what are the like, this is a critical emergency, let's go to the hospital warning signs?
Right. I mean, we've already talked about dehydration. That's one of the biggest concerns, particularly in the illness. Rapid or difficult breathing, bluish discoloration in the lips, lethargy, high fevers, obviously
Okay.
kind of seizure, because you can get febrile seizures, which is
Sure.
a high enough fever that your child ends up having a seizure. And so those are the pretty obvious ones. But as I said earlier, it really depends on how old your baby is, and your pediatric provider should be giving you a guideline because, again, a 102 fever in a 2-week old is going to be very different and concerning, whereas if it's a 6-month old. So,
Sure.
but those are just some big kind of buckets to think about.
No, super, super helpful. And I'm sure, yeah, people are getting that information from their doctor as well. So in terms of contracting RSV, how does that happen? Is, obviously daycare and children being around other children, is one, but if your baby is home, like, should you not take them to the grocery store in December? Like, what are the ways that this happens, and what are some things that parents can do to just, you know, prevent as much as possible, or what do you tell parents in these winter months?
Yeah, it's a great question. I think having again the conversation with your pediatric healthcare provider. So if your child is a premature infant or has congenital heart disease or has an immune system difference, that is obviously a big concern. And I think we'll get into this a little bit later, but there are some new medications that are on the market now to help reduce the likelihood that your child will get RSV, or reduce the severity of the illness if your child does happen to get it. But just, I mean, obviously hand washing. There's a lot of social media memes and so on about not letting random people kiss your baby in the face, right? I mean, there's just no reason to do that, right? There's lots of parables out there
They're
like,
so
oh.
cute. How can you not kiss a baby on the face?
Right. Yeah, but I mean, I just think common sense stuff, like, and it's hard, right? If you have more than one child and you're kind of having to, take the older one to a birthday party and the younger one is there, but there are understanding what's going on in the local community is really important. So there are places that aggregate data. The CDC aggregates data of where RSV is on the rise, and if you have a children's hospital in your area, they often will publicize the positivity rates of the different tests, whether it's flu, RSV, etc. So just being aware of what's going on in the community, and again, if your child gets RSV, it's not the end of the world, but it's just serious, and you need to kind of reduce that exposure if you can, within reason. Washing hands, don't let random people kiss your baby. If there is a lot of it, it's on a great uptick in your community, then maybe thinking twice about going to, I don't know, Chuck E. Cheese or one of those trampoline places or what have you, right? But at the same time, as a parent, I don't think you need to like be necessarily a hermit for 6 or 9 months, because that's not good for your mental health. It's not good for your baby, and so on.
Yep, totally. So quick question. Oh, never mind. We had some feedback that the audio was off, that people couldn't hear us, but I think we're good. If other people can't hear us, please let us know and I'll make sure that we adjust the issue, but I think we're okay. Okay. just that. So there was just a quick question about the kissing of the baby. I think the question is, are you saying there's no reason to restrict people from kissing the baby? It sounds like there is a reason to restrict people from kissing the baby, specifically the baby's face. And specifically if your baby is premature or quite young, or if there's a lot of illness in your community. Is that right, Dr. Goudy?
That is correct. I'm not saying that parents can't kiss their babies, but I would just say, look, I mean, it's a personal choice, right? I would say it doesn't make sense to me as a medical provider to have a lot of people that may not, they may just be sick or not know it, kissing your baby's face,
Sure.
particularly if they're under a year of age.
That's super helpful and a good guideline. Maybe a quick, hard conversation, but hopefully people understand that you're trying to prevent illness. Okay, so we are about to get into remedies, but there was another question that I'll just ask now. Just quickly discuss the differences between RSV and pertussis, risks or precautions, any differences there. Do you mind just giving a quick overview?
Yeah, I mean, so pertussis is something that children get vaccinated against, and is kind of a very different. It's called whooping cough. They cough, 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 cough. So that is a completely different thing. And I don't think that the RSV, it's certainly that it may be hard to figure that out, but it is something that can be treated with antibiotics and so on. But it's different. It's a bacteria versus a virus. There is a vaccine for pertussis, and your child gets that vaccine. I'm not here to talk about vaccines and all of the controversies around that, but it's a pretty standard thing that we monitor and treat. But certainly we can see that. I knock on wood, haven't seen that much. And so I think initially it may, there may be some of the same symptoms, but if your child has gotten the standard vaccinations and there's not a high prevalence in your community, it's probably less likely than, and then RSV, there are tests. I guess the other thing I'd say is, if you're worried that your child has RSV, there is a test for it. So we can, and other viruses. So we will run what's called a respiratory viral panel, or RVP, and then we'll know, right? And so you can get to that yes or no question pretty quickly. Is it RSV or is it pertussis?
That's a really helpful thing. People might not know there's a test which can tell you if this is what it is. And it sounds like it's different enough that a medical provider would be able to potentially tell the difference based on the type of cough, or whether the child's had the vaccine or not, or they'd go through a number of questions.
Well,
okay,
yeah, we just go down a list and start crossing things off, and it's kind of like being Sherlock Holmes sometimes.
Love it. Okay, well,
exactly.
Keep asking questions. These are great questions. So we want more questions from you. So please keep asking, and we'll save some time at the end. But let's get into some either home remedies or remedies for RSV. Like, how do you suction a baby's nose? That sounds really hard and kind of scary. So you tell us, because you're the expert.
Yeah. Well, I mean, and I'm a pediatric ear, nose, and throat surgeon, right? So you would think I would have been an expert at this at the very beginning. However, number one, I'm a little bit older than most of the people here, probably. So when my child was born 21 years ago, I didn't know what I was doing. I had no idea. I mean, I had been to medical school, I was in residency, but really went home with the blue bulb, and they pat you on the back and say, good luck, here's a list of 400 things to look out for, and oh, by the way, you've got to use this to clean out their nose. And so really, again, babies have to breathe primarily out of their nose, and when they get a bad cold, they can't breathe, they can't eat, they can't sleep. So nasal hygiene, meaning cleaning out the nose, is important. So nasal saline, sterile saline, is a good way to get some of that stuff out of there. And I know it's lunchtime, but if you get these big crusty boogers in your kid's nose, you got to get it out, or they can't breathe and they won't eat. So put some saline in there, let it absorb. So let it kind of get in there. The saline that that you can buy. It should be sterile. Don't necessarily try to make this at home, but it has more saline, more salt in it, so it pulls swelling out of the tissues, and it breaks up that stuff so you can suction it out. And you can use the blue bulb. There's other like 1,000 different things that you can use to suction the nose, but getting a clear nose, like if you have a bad cold, it's hard to breathe, you can't eat very well, and so on. So your baby's the same. So
And the baby doesn't have the instinct to blow out, right? Like the baby's not going to like have any understanding of how to clear their own nose. So that's up to you as the parent.
Yeah, that's not until 4 or 5, depending on your kid. So yeah, so there's a lot of devices on the market that can suction or remove the secretions from your baby's nose. And again, there's not an instruction manual. Oftentimes it becomes potentially a 2-person job, because then your kid's like moving their head all around and is trying to like floss the teeth of a saber-toothed tiger, but you're trying to help them breathe. And I would say one of the other benefits of cleaning out the nose is that not only are you cleaning out all the mucus so they can breathe and then eat, but it reduces the likelihood of a sinus infection, potentially reduces the likelihood of an ear infection, just because the sinuses are under the eyes, between the eyes, and the ear is drained at the back of the nose. And so if you clean all that stuff out, it doesn't get quite as blocked up.
Got it. That makes a ton of sense. Yeah. So, and you mentioned feeding. So is a good time to suction a nose prior to eating, or like what do you recommend in terms of timing?
Well, I mean, obviously, if they can't breathe and they're kind of working hard, you need,
of course, sure.
But certainly the strategies that I talk to families about is cleaning out the nose right before they feed, right? So, it's kind of eat and then sleep, right? And so cleaning it out, they'll get probably fired up, then they're awake, right? Because half of these kids like to fall asleep when they're eating. So you get them really awake, get them breathing good, they'll eat good, hydration will be good, and then hopefully they'll sleep good, and then maybe intermittently suctioning them during the night if they need it. One of the things I told this story earlier is I had a child that was admitted to the hospital, and the family was really frustrated because they're like, look, I don't need to be here, I just need a better suction. And that's what a doctor knows best invented, and my wife takes credit for it. I think, obviously I have to give it to her. She's like, why do we have this stuff that doesn't work very well? And you're a pediatric ENT and you need to come up with something better. So we invented hospital grade suction so people could, not only use that strong suction, but a device that fits on your fingers so that you can also hold their face. Because when they're wriggling around and you're trying to hold their face and their arms and their legs and suction, their nose and not poke their eye out, it can be a real struggle.
Big time. That is, yeah, I have flashbacks of that. And that was actually a question we just got. How many times a day? So when your baby has a cold, so it sounds like, as needed to clear their, nasal passages so they can breathe, potentially before feeding. So hopefully that helps. Suggestions on suckers. So obviously the doctor knows best is one that you highly recommend. You can say more, sure, if you'd like. And then how do we know we're not harming a baby's nose when we're suctioning their nose? Like, is there something is there like a line of,
right,
don't go past this part of a nose? I don't know.
Yeah. Well, and so that's a great question. And a lot of people ask me kind of more directly, like, how do I know I'm not going to suck my kid's brains out, right? And so I would say, I mean, with the blue bulb, what I ended up doing, and this is not doctor recommended advice, but I just was so frustrated with it. I mean, you have to basically put it in far enough that it creates a seal. So there's like, it goes in there. And then I would close the other nostril and like let it come out. My kid would freak out because it's basically closing that circuit because you can't get the suction. There are all kinds of nasal suction devices that are on the market. It can be a little bit confusing. Really it's what works best for your child. I mean, some you're actually putting one end in your mouth and the other in the kid's nose, and some people love that. I mean, I think certainly, that may also contribute to you getting potentially ill just because you're inhaling that virus down into your lungs and kind of bypassing the normal filters. I mean, there's battery operated ones, there's ones you plug into the wall. So I'm not here to sell you anything. I'm just here to provide information. Sure. But, when your kid can't breathe, it is a very as a parent, I was a doctor and I'm watching my kid struggle to breathe, and be congested. And that's just not a great feeling.
Yeah, it's scary for sure. Those blue bulbs, or I guess any of these, and they vary, I'm sure. How do you sterilize it? How do you clean it once so you don't get your child sick the next time?
Yeah, I mean, and again, if you have multiple children, not taking the same thing and putting it in another kid's nose, but and so yeah, I don't. The blue bulbs, I don't really have a good answer for you. I mean, there's all kinds of bacteria that can grow on things that are called biofilms that can kind of build up. So you need to be thoughtful about that. You can't really clean out the inside of the blue bulbs. I mean, they do sell ones that you can kind of unscrew. I don't, but again, the blue bulbs. I mean, unfortunately, my kids are older, but I would say that those are, if it works for your child, great. But they're pretty low tech and certainly hard to clean. And then some of these other different devices, you just have to wash them, put them in in your dishwasher, and really try to or I mean, if you have a baby sterilizer at home, you can put it in there too.
Cool. Okay, that's helpful. We have a question. Is there such thing? And by the way, now's a great time to keep asking questions because we're in that last 10-minute zone. So ask away and we will ask Dr. Goudy all the stuff you want to know. So is there such a thing as doing too much suction or doing it too frequently?
Yeah, and that's a great question. It really gets to what does your child need and how are you doing it, right? And I think you asked this question before. I didn't fully answer it. Like if you're having to put something in there all the way deep enough to kind of create a seal, it's gonna, the tissues inside the nose are pretty sensitive, and so you need to be thoughtful about it. One of the things that you probably may not know is that you have a wall between the sides of your nose, so it's called the nasal septum. And so if you're pointing it, when you're putting it in, if you're pointing it towards the middle, you're going to scratch that. So if you're putting something in your child's nose, you don't want to go very deep, and you want to either go straight or a little bit to the side. The way we designed our nasal suction devices, it just doesn't go in very far, just because it doesn't have to. But certainly, what you're using, just use it when they need it, and don't really try to jam it in there just because it can cause some bleeding and so on. If for whatever reason your child does have a nosebleed, you can just hold pressure on it like that. Obviously, if your baby is pretty young, you probably don't want to grab both sides. Maybe just push on one side just because they're breathing through their nose. And then saline, again, just keeping it hydrated is hugely important.
Right. And it sounds like a good rule of thumb is if you do it and then it seems like your child is breathing better, you can sort of assume that you got out what needed to come out and, they seem more comfortable, right? And then maybe you can take a break for a while, let them be.
Well, the other thing is a lot of people say, well, my baby still sounds congested. And when they have a cold, the tissue is swollen, right? So even though you're getting kind of mucus and boogers out, they're not going to sound the same. It's like when you and I have a cold, there's swelling because the body is fighting off the virus and there's swelling in the tissue, but that's why the saline is really important because it pulls some of that swelling out and it kind of washes things out. But I obviously don't just pour a gallon in there, just use a couple drops. Or I like the mister because then it just kind of aerosolizes it or kind of puts it in the air versus, kind of dropping a bunch of saline in there.
Got it. Okay. And so just one person clarifying, when the baby has a cold, would it be something you would routinely do just like before eating and before sleeping, or is it sort of more as needed?
I think everybody's an individual, I mean, from the company standpoint, there are people that tell us they use the nasal suction device all the time. But I think, if your kid isn't congested and it makes them crazy to do it, I don't see a reason to do it. But if your kid, every time they get stuffed up and then they end up, 10 or 14 days later with a sinus infection, I would definitely say keep the saline going, reduce the likelihood of needing antibiotics and all that other stuff.
Awesome. Another question from the folks on the call is about Dr. Knows Best specifically. Can you share sort of the differentiators or the key benefits of, I know you're not here to sell us a nasal aspirator, but folks want to know sort of what makes it different.
Right. So it is a portable, rechargeable, hospital grade suction, and it also has this 2-finger design so you can suction both nostrils. And so it makes it quicker and more efficient. it's covered by HSA, FSA dollars, and so on. And I guess the other thing I'd like to plug as it relates to the company is that we are focused on giving back. So a portion of our proceeds go to support the National Down Syndrome Congress, which, I told the story about the patient said, "I don't need you," the mom told me, "I don't need you," and her child had Down syndrome. And so some babies are born with smaller nasal passages. They struggle more significantly. But figure out what works for you. I mean, we obviously feel like what we've created meets the needs of families and makes life easier, hopefully, or at least addresses what my wife told me to do. But yeah.
Super helpful. Thank you. I'm converted. I'm going to go buy one after after we get off the call, or go order one. So when you're building, either maybe you're pregnant and you're thinking about what to have on hand at home, for the upcoming, winter season, what are some things parents can think about putting in their toolkit to have at home? I know you mentioned saline, maybe one of these aspirators. Is there anything else you recommend parents have on hand in the case that their child gets sick?
Yeah, I mean, I think, again, the most important thing is having that kind of preemptive conversation with your pediatric provider, because based on their age, most of the time they come home, they're cranky, they may have a fever, and knowing what to do about the fever, because fever control is super important, not only just because they're cranky, but if they have a high fever, they're also losing liquids that way, and knowing what to do and what you can give them. All treatments for children are based on their weight. So understanding, you can buy infants, ibuprofen, infant, acetaminophen, which is Tylenol, but knowing how old they should be and how much to give them, that you need to have that dialed in. So that way you're not like sleep deprived trying to calculate something. Understanding, have a chart like how much they need to be peeing. There's really not any cough suppressants that are on the market for children, so managing that humidity in your child's room is really important. I think, if your child is going to be in daycare, they're going to get sick a lot, so figuring out which nasal suction device makes sense for you, having wipes to wipe off their nose because it gets like dry and crusty, and then that's a frustrating thing. And then taking it on vacation. For whatever reason, when my kids were little, every single time we went on vacation, our kids were sick. So just not,
It's so interesting. I'm always packing, and I'm like, they're fine, right? And then, of course,
right
there.
Yeah.
Coughing. Cool.
Yeah.
Okay.
I would say, like, if they're over the age of 1, you can consider honey for cough, but it has to be, your child has to be vaccinated against certain things, and the honey should be of a certain grade and quality and so on. That's the only cough suppressant that is available today on the market for and it tastes good, but you just need to have a conversation about it.
Sure. And maybe you mentioned this and I didn't hear, for the home kit, a good thermometer makes a ton of sense.
Yeah. I mean, and they sell all kinds of fancy ones now, so making sure that that's the case, that what your child's temperature is, and you have a reliable thermometer that works on you and is easy to get done on your child.
Great. Okay, we have 2 minutes. We have more questions, so we for sure will send Dr. Goudy questions that we didn't get to so that we can get the answers for you. Sarah is going to send a post-webinar follow-up email, which she always does. It'll be a bit delayed this week just because she's out of town, so this weekend you will get that. It'll include any links or recommendations Dr. Goudy has and some summaries of what we've talked through. I did want to make sure there's a question that we got and that we are seeing about a vaccine available for pregnant moms, and whether that's something you recommend or know about. Obviously, a conversation is due with a pediatrician or an OB/GYN, but what is that all about? Maybe we could close it out with, with that information.
Yeah, I mean, I think there's 2 things, right? There's the new vaccine for moms, and so as we discussed, the maternal immune system, the antibodies from mom actually pass to your baby. So for the first 6 months of life, your baby is protected by what your immune system is. And so if you, as a pregnant mom, pass antibodies against RSV to your baby, that, protects your baby for the first, 6 months or so of their life, which is hugely important. So I think, an educated discussion with your OB/GYN is important, but certainly I see that as an important thing to consider, particularly for your baby's health in the first 6 months when they're the most vulnerable. And now the good news is that, you know, children have access to what's called a monoclonal antibody, which is a shot that they can give to protect your baby, you know, particularly under the age of 8 months of age, because, you know, RSV can lead to such significant illness in this patient population. That's a conversation that you should have with your pediatric healthcare provider, but that's now available. And I think that that will also hopefully reduce hospitalizations and potential other consequences of getting RSV.
Amazing. Well, it's a great time because it's late summer, so pregnant
Yes.
parents think about that now for the upcoming season. So, Dr. Goudy, thank you so much for your time. We have so appreciated. I've learned a lot, and I know everyone else has as well. So, as I mentioned, Sarah will send that email. Keep an eye out for it later this weekend. And enjoy, everybody. Dr. Goudy, thank you so much for being here, and we really appreciate your time.
Thank you all very much. It was a great conversation.
Fabulous. Thank you, everyone. And we'll see you on the next call. Bye.
Bye.